A warm welcome to all of you. I am Shivang Khandelwal from Inforich. Healthcare is transforming from human touch of doctors, nurses, and allied health professionals to devices and now information technology. AI-based healthcare solutions can help in making healthcare services more proactive, moving from sick care to true healthcare. Today we are with Mr. Nishant Nambiar from Inforich Technology Solutions to understand how he fills the gap for innovation in healthcare. So welcome Mr. Nishant. We are glad to have you today.
Yeah, thank you so much, Shivan, for having me on this.
So tell us about yourself and Inforich Technology Solutions.
Yeah, actually, Inforich Technology Solutions was born in April 2012, and from that time onwards, our focus has to was actually to solve the healthcare problems in the health informatics space specifically. So we were trying to build a solution or a platform which will solve the problems for entering the data from the doctor's perspective, a nurse's perspective, and ultimately from all the stakeholders in the ecosystem. So with
Yes.
this solution, we two founders started this off, and it's been like a long journey, 7.5 years of experience. And this has taught us, and we have all created client bases across the Middle East, Southeast Asia, and India. And we hope to take this as a global product.
Nice thought, sir. And what was the thought to create an entity to work on the problem of healthcare? So, what was
Yeah,
the motivation?
yeah, basically, it's a very simple motivation because when you personally go to any hospital, you don't have all your records in one place. So, multiple times people ask you, what is your age? Very, very simple things, starting with what is your age, what is your name. So, those basic things are also not solved. We have a lot of IT systems at the moment in the hospital environment or the clinical environment, but then these are more of billing solutions. So like electronic medical record system, you don't have something very comprehensive. Just as a quick check, if you want, just go back and see whether you have your medical history for the last 1 year or 2 years. So that itself will answer your queries. So this is the very strong pain point which is required. But with the futuristic thing, there are a lot of technologies which can actually help you to predict diseases. So if you have a history of data with you, you can actually predict, and this will actually help you to prevent and protect yourself from more diseases and all, falling sick. So the model which we are trying to focus is to move from sick care to health care.
Yeah. And what are the challenges in implementing an AI solution, and how did you overcome it?
Yeah, basically, this is a terminology which is very, very widely used nowadays, artificial intelligence. Okay. So
Yeah.
we were using this technology almost like 7 years back, but we did not put the term like AI on top of it. So the whole model is like when you have data in one place, then only you will have the AI and all to run on it, whatever algorithms we build. But the challenge at the moment is we don't have data in a structured format from different sources. So that is the first point. So we are trying to solve that problem to aggregate the data into one place so that all the hospital owners or the patient side or the doctor side, they all can accept the data in whatever form and then make meaningful outcome out of it. That is where we will use techniques like AI and machine learning. So these two things will help improve the efficiency of the doctors so that they can see more patients very quickly and more accurately. That is the most important point.
So you talked about data. Data protection bill is coming in India. How the EMR companies like you will change its strategies in data collection, storage, and transfers, etc.
Sure. So now, whenever we any ERP solution, which is like EMR, is one of the database application. So data is the most critical element. Everybody says data is the new oil. So definitely you need to secure it. How do you secure it? So there are a lot of protocols which are coming up, which has to be defined, authorized by the concerned cybersecurity team or the Ministry of Defense, and all those guys are supposed to manage all this data. So what we are trying to do is we have the capability in our product to tweak the data in such a way that you yourself will find the data in a secured place. So the data regulatory companies can tell us what are the requirements and we can very easily comply to it. So that is the strategy. So we flipped it from that side. We don't have to change our product. Only thing is, you tell us what are the regulations which you want to implement in the region. We can get complied to it automatically, because what we are trying to build is a global product. So maybe the rules in India might be different from the rules in US. Maybe rules are different in Europe. So our
Yeah.
solution is capable of adopting to multiple security levels at different country levels. So this is where we have this kind of a idea which is coming up. Like in Europe, we are working on GDPR, because that is the way how you protect your data. So we are
Yeah.
already into it.
So AI is accelerating, and you being an AI, EMR and AI company, do you think healthcare is prepared for it?
Yeah, healthcare at the moment is not prepared. That's what I said, because the data is not in single place. At the moment, we have created a lot of silos. So all your data is in different parts. So first thing is you have to integrate everything together. Then only you can talk about AI. So the first challenge for AI to be executed is to have the data in one place. So that is where we are working on, and we are getting all the stakeholders to put data in a structured format so that it is much more easier to manage.
Yeah, data is the king.
Yeah, sure.
So, how does your organization fuel innovation in healthcare IT?
Yeah, I think innovation actually comes in when you get closer to the customers. So our customers being the hospitals and clinics and doctors and all, we spend a lot of time with them. We understand what are their pain points. We don't develop solutions sitting in our offices. Okay, so we actually get on the ground, discuss with the IT guys, discuss with the doctors, understand what are the problems. And technology has got a lot of benefits like AI, machine learning, and all. But doctors need not understand that. So it is our responsibility to understand the technology, and it is the doctor's responsibility to just tell us the problems what they're facing, and technology can solve all that problem. So listening to the customers at their locations is the most critical element, and that is how we think innovation is helpful. Otherwise, if I innovate sitting in my office, that might not be relevant to them.
So, to all the startups out there who are hustling in AI in healthcare, what message would you like to give them?
My advice to all the healthcare related startups is to focus on one domain. Like it could be cancer, it could be diabetes, it could be obesity. Concentrate on one, and then build a huge database on that, and then maybe you train your algorithms and all based on that. And then you go to the next leap where you can go on scale and use this evidence based kind of solutions to take the what you call the best practices and all across different parts of the world. So I think that's the way to go forward. Focus on one niche domain and then be the master in that. Have a lot of data, because people are not very comfortable sharing data. So first thing is to build that confidence for them to share the data, telling them that you will give them more insights from which they can take decisions based on that.
Yeah. Thank you, Mr. Nishant. It was very informative talk with you. We hope that our audience would have liked this and got the answers from you. How you fill the gap for innovations in healthcare. And as a healthcare startup facilitator, we will facilitate you to reach the right people through our different activities like annual international healthcare conference, webinars, club meetings, market access program, trainings on artificial intelligence, cybersecurity in healthcare. We have quarterly magazine on healthcare innovations where you can showcase your innovation and reach to our 78,000 plus healthcare stakeholders. So we also have a Udemy course on for for healthcare security. So
Okay.
we can collaborate on these things.
Yeah, definitely. So whatever you feel appropriate, I'm happy to support any initiatives in health informatics at the moment from the Indian context.
Yeah. Thank you, Mr. Nishan, once again.
Thank you so much, Shivan.